Borderline personality disorder, BPD, is a complex mental health condition characterized by pervasive instability in moods, behavior, self-image, and functioning. This disorder often results in impulsive actions and problems in relationships. People with BPD may experience intense episodes of anger, depression, and anxiety that can last from a few hours to days. Understanding BPD is crucial for recognizing its symptoms, seeking appropriate treatment, and supporting those affected by the disorder. BPD is a serious mental illness marked by unstable moods, behavior, and relationships. Individuals with BPD often struggle with self-identity and maintaining consistent interpersonal relationships. The disorder typically manifests in early adulthood and is more common in women than men. BPD's emotional instability often leads to extreme mood swings and erratic behavior, making it challenging for individuals to maintain a stable sense of self and healthy relationships. Key symptoms of BPD: intense fear of abandonment. Individuals with BPD are often terrified of being abandoned or left alone. This fear can lead to frantic efforts to avoid real or imagined separation or rejection, sometimes resulting in impulsive actions. Unstable relationships. People with BPD tend to have intense and short-lived relationships. They may idealize someone one moment and then suddenly believe the person does not care enough or is cruel. Unclear or shifting self-image. A distorted or unstable sense of self can lead to sudden changes in values, goals, aspirations, or sexual identity. People with BPD might feel as though they do not know who they are or what they want from life. Impulsive behaviors. Engaging in impulsive and often risky behaviors, such as excessive spending, unsafe sex, substance abuse, reckless driving, or binge eating, is common among individuals with BPD. Self-harming behavior. Self-injury, such as cutting, burning, or hitting oneself, and suicidal behaviors or threats are severe symptoms of BPD. These actions are often a response to emotional pain or as a means to feel something physical when feeling emotionally numb. Emotional instability. People with BPD experience intense and rapidly changing emotions, often without an apparent cause. These mood swings can last for a few hours to a few days and can include intense happiness, irritability, shame, or anxiety. Chronic feelings of emptiness. A persistent feeling of emptiness or void inside is commonly reported. Individuals may feel as though there is a hole or void inside them, leading to a constant search for something to fill it. Explosive anger. Intense and inappropriate anger or difficulty controlling anger, such as frequent displays of temper, constant anger, or physical fights, are hallmark symptoms of BPD. Paranoia or dissociation. Under stress, individuals with BPD may experience paranoid thoughts or severe dissociation, feeling detached from themselves, which can lead to a sense of unreality. Causes and risk factors. The exact cause of BPD is not fully understood, but it is believed to result from a combination of genetic, environmental, and social factors. Key risk factors include genetics. Studies suggest that BPD has a hereditary component. Individuals with a family history of BPD or other mental health disorders may be at higher risk. Brain structure and function. Research indicates that individuals with BPD may have structural and functional changes in areas of the brain that control impulses and emotional regulation. Environmental factors. Traumatic life events, such as childhood abuse, neglect, separation, or loss, are significantly associated with the development of BPD. Neurobiological factors. Dysfunctions in neurotransmitters, particularly serotonin, are thought to contribute to the emotional instability and impulsivity seen in BPD. Diagnosing BPD involves a comprehensive evaluation by a mental health professional, often including clinical interviews, detailed interviews that explore the individual's history, symptoms, and behavior patterns. Medical history, a thorough review of medical and psychiatric history to rule out other conditions that may mimic BPD symptoms. Psychological testing, Standardized tests and questionnaires may be used to assess personality traits and symptom severity. Criteria from DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines specific criteria that must be met for a BPD diagnosis. According to the DSM-5, an individual must exhibit at least 5 of the 9 key symptoms. BPD can significantly impact an individual's daily life and relationships. Interpersonal relationships, the intense and unstable relationships typical of BPD can lead to frequent conflicts, breakups, and difficulties maintaining long-term relationships. Friends and family members may struggle to understand and cope with the individual's erratic behavior and mood swings. Work and academic performance, emotional instability and impulsive behaviors can interfere with job performance and academic achievements. Frequent job changes, conflicts with colleagues, and difficulty concentrating are common challenges. Self-esteem and identity issues, chronic feelings of emptiness and an unstable sense of self can lead to low self-esteem and a lack of direction or purpose in life. Legal and financial problems, impulsive behaviors, such as reckless spending, substance abuse, and legal infractions, can result in financial instability and legal troubles. While BPD can be challenging to treat, effective therapies and interventions are available. Psychotherapy, the cornerstone of BPD treatment, several types of psychotherapy have proven effective. Dialectical behavior therapy, DBT, specifically designed for BPD, DBT teaches skills to manage emotions, reduce self-destructive behaviors, and improve relationships. Cognitive behavioral therapy, CBT, focuses on identifying and changing negative thought patterns and behaviors. Schema-focused therapy combines elements of CBT with other forms of therapy to address dysfunctional schemas, patterns of thinking and behavior. Mentalization-based therapy, MBT, helps individuals understand and interpret their own and others' emotions and thoughts. Medication, while there is no specific medication for BPD, certain medications can help manage symptoms such as mood swings, depression, and anxiety. These may include antidepressants, mood stabilizers, and antipsychotic medications. Hospitalization, in cases of severe symptoms or suicidal behavior, hospitalization may be necessary to ensure the individual's safety and provide intensive treatment. Support groups and peer support, joining a support group or connecting with peers who understand the challenges of BPD can provide emotional support and reduce feelings of isolation. Self-care strategies, encouraging self-care practices, such as regular exercise, healthy eating, adequate sleep, and mindfulness techniques, can help individuals manage stress and improve overall well-being. Coping strategies and support. Living with BPD requires ongoing management and support. Here are some strategies to cope with the disorder. Educate yourself and others. Understanding BPD and educating loved ones can foster empathy and support. Develop a support network. Building a network of supportive friends, family members, and mental health professionals is crucial. Establish healthy boundaries. Setting and maintaining healthy boundaries in relationships can prevent conflicts and promote stability. Practice stress management. Techniques such as mindfulness, meditation, and relaxation exercises can help manage stress and prevent mood swings. Engage in regular therapy. Consistent therapy sessions can provide ongoing support, skill building, and symptom management. Create a crisis plan. Having a plan in place for managing crises, including emergency contact numbers and coping strategies, can be life-saving. Despite effective treatments, managing BPD can be challenging due to several factors. Stigma. The stigma associated with BPD can prevent individuals from seeking help and support. Complex symptoms. The emotional instability, impulsivity, and interpersonal difficulties characteristic of BPD can make treatment and daily life challenging. Co-occurring disorders. BPD often co-occurs with other mental health conditions, such as depression, anxiety, substance abuse, and eating disorders, complicating treatment. Treatment resistance. Some individuals may not respond to standard treatments, requiring more intensive or alternative approaches. Emotional pain. The intense emotional pain and turmoil experienced by individuals with BPD can be overwhelming and difficult to manage. Ongoing research is essential for improving our understanding of BPD and developing more effective treatments. Areas of focus include genetic studies. Identifying the genetic factors that contribute to BPD can help in developing targeted treatments and preventive strategies. Neurobiological research. Studying brain structure and function in individuals with BPD provides insights into the underlying mechanisms of the disorder. Novel therapies. Researchers are exploring new therapeutic approaches, such as neurofeedback and transcranial magnetic stimulation, TMS, for treating BPD. Early intervention. Identifying and treating BPD early, especially in high-risk individuals, can improve long-term outcomes and prevent the progression of the disorder. Personalized medicine. Advances in personalized medicine aim to tailor treatment plans based on an individual's genetic makeup, lifestyle, and specific symptoms, improving the effectiveness of interventions. In conclusion, borderline personality disorder is a complex and challenging mental health condition characterized by emotional instability, impulsive behavior, and difficulties in maintaining relationships. Understanding BPD's symptoms, causes, and treatment options is crucial for effective management and support. With the right combination of psychotherapy, medication, self-care strategies, and support, individuals with BPD can lead fulfilling and productive lives. Ongoing research continues to advance our knowledge of BPD, offering hope for more effective treatments and better outcomes for those affected by this condition. Raising awareness, reducing stigma, and promoting early intervention are crucial steps in supporting individuals with BPD and their families. Thank you for watching. Please subscribe, like, and share.